Breaking lockdown rules are to blame for a coronavirus cluster emerging in Melbourne's southeast. Joining me now live from Melbourne is Patrick Murrell. Pat, just how big is this cluster and how did it form?
Well, Danica, this cluster has grown to 34 cases since September 2. 7 of those were detected yesterday and 5 the day before that. No new cases in the cluster as part of today's daily increase. However, it is around that local government area of Casey. The 34 people spread across 5 different households in the suburbs of Clyde, Hallam, Narre South and Cranbourne North. It's believed the virus had been spread by people from these households illegally travelling outside their 5-kilometre zone and visiting other households, which is of course a breach of the lockdown laws. Now, at least one of those cases is believed to be an essential worker, although it's not known which industry they are from. Here's what the Premier, as well as the Department of Health spokesperson, had to say earlier today.
5Ks is one thing. Visiting other people's homes is the real issue here, frankly. The rules are in place for a reason, and anyone who undermines those rules undermines the entire strategy and just means the rules will be on for longer.
What we've seen is obviously some normal travel that we would expect people to conduct in order to get the necessary things for life. So the 4 reasons why people can leave home, and certainly we've seen some travel to shopping centres and stores largely within the 5-kilometre radius. But we've also seen in this particular cluster visiting of houses beyond the 5k radius. So these 5 houses in this particular cluster have had, unfortunately, some members of those households visiting other households.
Now, as a result of this highly localised emerging cluster, a decentralised and targeted effort has been made to try and track down all of those involved. Local community leaders have been engaged. New testing sites have been popped up. Anyone in those areas showing even the mildest of symptoms, specifically those who have been to the Fountain Gate shopping centre, are being urged to come forward and get tested, as well as that some additional methods are now being considered in that area which haven't been used in others, and that does include door knocking as well as asymptomatic testing. Danica.
Patrick Murrell, appreciate the update. Thank